If you're an average American who has contracted coronavirus and you end up in the hospital, you're unlikely to get the type of healthcare that Donald Trump received, but more importantly, you're much more likely to be slapped with a giant medical bill that will likely bankrupt you and leave your family members either evicted or hungry. And nothing makes that clearer when you break down the cost of the healthcare treatment that Donald Trump was able to receive and how much that would cost the average American. So Sarah Cliff over at the New York Times did a great analysis on this, and I want to share those details with you because it shows that our system is fundamentally broken. And the very people who claim that socialized medicine would be the absolute worst thing in this country get to take advantage of socialized medicine all the time. They love getting the free healthcare that's afforded to them through their jobs, the kind of healthcare that doesn't deny them any type of coverage or care. So let's go to the details. COVID tests, for instance, are actually pretty expensive. Although they typically cost $100, one emergency room in Texas has charged as much as $6,408 for a drive-through test. About 2.4% of coronavirus tests billed to insurers leave the patient responsible for some portion of payment, and that's according to the health data firm Castlight. Now, look, keep in mind that Donald Trump was getting tested several times a day. He doesn't have to worry about footing the bill for that. Of course, average Americans aren't gonna get the same treatment. They will have to deal with the costs associated with it. But let's talk about Trump's treatment. Remdesivir. That's a new coronavirus treatment created by Gilead. It costs $3,120 when purchased by private insurers and $2,340 with public programs like Medicare and Medicaid. The median charge for a coronavirus hospitalization for a patient over 60 is $61,912, according to a claims database, Fair Health. The figure includes any medical care during the hospital stay, such as an emergency room visit that led to admission or drugs provided by the hospital. So again, of course, Donald Trump was like airlifted to the hospital. He doesn't have to worry about all of this, all of the costs associated with getting the treatment that he needed. Didn't have to worry about the transportation. Let's talk about that transportation for a second. Imagine that you're so sick that you need to be airlifted to the hospital. What would that cost you? First, let's just acknowledge that most health insurers do not cover that type of transportation. We all know that, right? Air ambulances are expensive and often not in major health insurance plans networks. The median charge for an air ambulance this is the median charge, $38,770, according to a study in the journal Health Affairs. When the helicopter trip is out of network, as about 3/4 of them are, patients are left with a median charge of $21,698 after the insurance payout. So, I don't know which insurers do cover it, but if they do, it's still insanely expensive. You're still like footing the bill by a wide margin. So then keep in mind that 2 helicopter rides at the median price would be over $40,000. In total, it would cost Americans anywhere between $100,000 or $400,000, $100,000 to $400,000 to get the same level of medical care that Trump received. And by the way, the article didn't go into any detail or even explore the fact that Donald Trump has 7 doctors surrounding him, like supervising his care. Average Americans don't get that. We know this. So my favorite reaction to all of this came from the man himself, Bernie Sanders, who tweeted the following: Mr. President, you attack socialized medicine every single day. Well, let's be clear. The excellent care you received at Walter Reed was at a 100% government-funded, government-run hospital. For Trump, socialized medicine is bad for everyone but himself. Total hypocrisy.
And the thing with the coronavirus test, for me, I've been tested several times, but I went to get rapid testing because I needed it for work. One test was $125. The other test in another neighborhood was $250. So there's not even a regulated price for these tests, when people need to know for work purposes if they have it immediately. So imagine how, I mean, if they can arrange that way. What I don't understand, Anna, is the people who are continuously fighting for Donald Trump and can in no way identify with his financial situation. That's what I don't understand. That's what drives me crazy with people knocking the socialized medicine, when in fact, if they are the people who get COVID, they're the ones who suffer the most.
Yeah, no, you're absolutely right. And it's really hard to pinpoint why that is. But my guess is that these are people who have like basically experienced multiple presidential elections where people have not spoken to the issues that they're dealing with. And all Donald Trump needed to do was come in and pretend as though he was like some fake populist, or some populist, although we know it's fake, and speak to some of the issues that matter to them, and they just believe him. It's crazy. Pew Research recently did a survey. In fact, I have it in front of me right now. Let me pull it up. And they asked people, what's the percentage? My bad. This is a Gallup survey. I want to make sure I get the source right. What percentage of Americans believe that they're better off today than they were 4 years ago financially? So September of 2020, 56% of Americans felt that they're better off today than they were 4 years ago. And the numbers were much lower before. So December of 2012, it was 45%, October of 2004, 47%, October of 1999, 38%. And so, I'm sorry, 1992, it was 38%. And so I give you those numbers because propaganda is incredible. Even if people are not experiencing firsthand any type of improvement in their finances, in their lives, just having someone like Donald Trump repeatedly say that I built the best economy ever, I'm the best president ever, look at how great everyone is doing. Like, that's all it takes for some people to be like, yes, it's true, our lives are better. Yes, we are broke, we're about to go bankrupt, but it's okay, our lives are better. It drives me nuts, but this is just the reality that we're dealing with.
Well, it's because speaking to their racism and their xenophobia, and they've able to get a lot of that stuff off their chest. It's more about, if you are still broke and you're still struggling and you don't have access to the best healthcare, what has Donald Trump made better for you? The fact that you can voice that you hate Black people, or you hate immigrants, or that women are second-class citizens, or that gay people should not be able to get married, and that abortion should be legal. That's why they feel like their lives are better, because they are able to release their hatred, their xenophobia, their sexism, their racism. And he's made it easy for them, so much that you got people kidnapping governors, trying to kidnap
attempting
governors.
to.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.